Coital incontinence. It's yet another challenging topic in urogynecology. So, what it is? If you randomly Google it, you might find various symptoms like feeling of escape of wind through vagina during coital activity, flatus incontinence, and many more. Let me make it very clear in the very beginning that coital incontinence is defined only as a leak of urine during sexual activity or coitus. This definition was given by International Continence Society and International Urogynecological Association in 2010 to remove all the confusions. As we are talking here about the escape of fluid during sexual activity, these are, we have to understand, mainly of three kinds. But please remember that not every lady will feel the presence of fluid escape during coitus. The prevalence of feeling of fluid escape during sexual activity is only around 50%. That means around half of women will normally not feel this kind of thing, which is perfectly normal. And all those who have this feeling, the quantity may vary a lot, from as less as 1 milliliter to as high as up to 900 ml or say 1 liter. Vagina transudates some fluid during the act of coitus for lubrication. There is some fluid that may come from the bladder, commonly which is known as squirting or female ejaculate. It also may have some secretions from female prostate or Skinny's gland, which pour into the urethra. These all are known as physiological reactions to increase blood supply locally. However, the third type is urinary incontinence during coitus, known as coital incontinence, and only this one is pathological. Though the occurrence and source of these various fluids has been confirmed by chemical analysis in labs by estimating the amount of urea, creatinine, prostatic specific antigen, etc., in different fluids. However, in clinical practice, the diagnosis of emitted fluid is entirely based on its quantity, its appearance, and the subjective feeling what the lady experiences during their escape. Among these, the subjective feeling is the most important one. The lady who is having coital incontinence will complain of negative feeling towards it as compared to the other two groups. She usually will admit avoidance of sex because of anticipation of this event. And nonetheless, she will have this leak not only during coitus but also during other times of the day in form of either stress urinary incontinence or urge incontinence. Around a decade ago published, this was the first largest study that used a validated questionnaire to understand the prevalence of coital incontinence. And they found a prevalence of around 60% among their cohort of around 500 women. One more thing they realized that worsening urinary incontinence had a deleterious effect on sexual functions. Again, they emphasized the clinical features of coital incontinence that include women with coital incontinence experience leakage of urine frequently and involuntary during the day. Most women with this problem avoid sex or prevent involuntary urine leakage by voiding immediately before the sexual activity. Coital incontinence had significant negative impact on the quality of life also. Coital incontinence here was classified into two groups: coital incontinence as at penetration, which is known as CIAP, and coital incontinence at orgasm, that is known as CIAO. For years, we thought that coital incontinence at penetration is seen in cases with stress incontinence, while coital incontinence at orgasm is seen in women with detrusor overactivity or urge incontinence. The same hypothesis was studied in this very recent paper, published this year in 2021 itself, but what they found was a little game changer. They found that coital incontinence is much more strongly associated with stress urinary incontinence than with detrusor overactivity in their population. And coital incontinence seemed to be manifestation of SUI even when it occurred during orgasm. So it was more strongly associated with stress incontinence, then it looks normally that it will be more commonly associated with urgency or urge incontinence. And here in the study, we are not just talking about the clinical diagnosis of incontinence, but these women had a proven urodynamic diagnosis of stress incontinence and overactive bladder. Most of these studies are actually done in Western population. What about the Asian population? I could find only this single study which was done in Asian continent in Taiwan, and it also shows almost the similar prevalence of around 56% in our women. Unfortunately, though the consultation seeking behavior in this cohort was very, very poor. Can you imagine? Only 9% women sought consultation for the same before they were questioned directly about it. Then there is this multicentric international study, which included women from Italy, Greece, America, and Egypt. Other than confirming the high prevalence rate, they were the first one to look into various risk factors that contributed to the ailment of coital incontinence. What they found was that women who had undergone hysterectomy and who were obese had higher risk of coital incontinence as compared to their counterparts. They also supported that increased severity of urinary incontinence positively correlated with coital incontinence and had a negative impact on the quality and frequency of their sexual activity. Now we know what is coital incontinence, how much prevalent it is, and it's really bothersome. But when in clinical scenario a patient comes to us, how do you assess it? It is not just about yes or no. Till date, only one questionnaire has been developed that focuses specifically on coital incontinence, and that has been developed in Istanbul, Turkey. And it's not yet translated and validated in any other language, that includes English also. So, it can be a very good project and an opportunity for you to carry on a project, translate it, and publish it. Having assessed it, the bigger question is it treatable? And the good news is yes, it is completely or more or less so. The principles of treatment are simple. Coital incontinence at penetration is cured in more than 80% of cases with the help of surgery if it is associated with stress incontinence. Coital incontinence during orgasm can be treated with antimuscarinics in about 60% of cases, especially when it is associated with detrusor overactivity. However, more recently, there has been emergence of a bit different concept. Till last decade, we thought it was simple and mathematical. Coital incontinence at penetration is related to SUI treated with mid-urethral slings. Coital incontinence at orgasm is related to overactive bladder treated with antimuscarinics and other therapies. Now look at this paper. The study had more than 2,000 patients and was published in IUGA just 3 years ago. It concluded coital incontinence is a very common problem and is reported by approximately 1 in 5 women who attended their urogynecology clinic and was found to be associated with avoidance of sexual activity. Coital incontinence was associated with both stress incontinence and urge incontinence, regardless of whether this occurred at orgasm or at penetration. This is important. And what they also prove that following tension-free vaginal trape, which is the management of stress continence, 60% of women reported being cured of both kind of coital incontinence, whether it was at penetration or at orgasm. This is another similar study which was just published a year ago. This also proved once again that CIAP and CIAO do not have clear-cut boundaries. There is a lap of overlap in between these two entities. But the good news is that those women, irrespective of what kind of coital incontinence they had, when they were treated with the help of mid-urethral trapes, the effect or the patient's improvement in quality of life and sexual activity was very, very satisfactory. Around 86% of patients said that they felt much better or very much better after the treatment. They did a subgroup analysis also and found that whether the problem was during penetration or orgasm, if it was associated with stress incontinence, the women showed a definite improvement in their sexual life as well as the quality of their life. So if I have to summarize it, that what coital incontinence is in clinical sense, I have only 3 things to tell you or take home. First one is assess it. Ask your patient about it better with the help of a questionnaire because it is common, it is bothersome, and people or the lady who presents might feel too embarrassed to talk about it. Let her speak. Second thing is, after finding out about this escape of fluid through the vagina during coital activity, it is very important that we confirm the diagnosis. But we do not have to do any test for it, just history and its impact on her or her personal life will tell you whether it is a pathological disease or it is the normal process or normal change during the activity. Third, and the best part is, when you find it, when you confirm it, do not hesitate to treat it and do the treatment. You don't have to do anything extra. Just treat the urinary incontinence, what she is having in the daytime or other times. This treatment will help her to take care of her coital incontinence also. Thank you.